Hi, my name is Stephanie Parker, and I'm at Wake Forest Baptist Health. P is for photon. A photon is an energetic packet of light. Photons don't have any mass, and they always travel at the speed of light in a vacuum. Photons are all around us. If their energies are in the visible light spectrum, then we can see them with our eyes. In medical physics, photons are used for imaging and treating patients. As photons enter a patient's body, they deposit most of their energy at or near the surface of the patient, and the energy deposition lessens as the photons travel through the patient's body.
Hi, I'm Bruce Libby, and I'm at Moffitt Cancer Center in Tampa, Florida. Q is for quality assurance. Quality assurance is the process in which equipment and processes are tested to make sure they are performing to the required specifications. Medical physicists are responsible for the technical aspect of radiation therapy and medical imaging. To make sure equipment is performing safely and as expected, physicists do a lot of testing on everything involved in the production, measurement, and calculation of radiation. A lot of the QA checks that physicists do in the clinic are not just on radiation-producing equipment, but we also do quality assurance checks on individual patient images or treatment plans. This is all a part of a physicist's job.
My name is Dandan Zheng. I'm at University of Rochester. R is for Radiopharmaceutical. A radiopharmaceutical is a special drug that contains a small amount of radioactivity. When a doctor prescribes a radiopharmaceutical to a patient, it's because the radioactive atoms in that drug are attached to molecules that will collect in certain body parts. The nuclear medicine technologists can then take pictures of where these special drugs accumulate inside a patient. Positron emission tomography, or PET, is a type of imaging that takes pictures of patients who have been administered radiopharmaceuticals. PET can be incredibly helpful for diagnosing, describing, staging, and monitoring the treatment of disease, especially cancer.
My name is Phillip, and I'm at Washington University in St. Louis. S is for shielding. Shielding is material that is used to block radiation or reduce its intensity. Radiation shielding with materials like concrete and lead is included in facilities that use radiation-emitting materials and equipment to diagnose and treat patients. Some radiation shielding is portable. Physicists who work on fluoroscopy units wear heavy leaded aprons to reduce dose to their bodies while they take measurements. Radiation shielding is important to make sure that both radiation workers and members of the public are not exposed to unsafe levels of radiation, as mandated by governmental agencies.
My name is Firas Mourtada, and I'm at Thomas Jefferson University. T is for technetium-99m. Technetium-99m is a radioactive version of the element technetium. The M indicates that it is an unstable form. Technetium-99m emits radiation when it decays to technetium-99 by emitting gamma rays. The time it takes for half of the starting technetium-99m to decay to technetium-99 is about 6 hours. Technetium-99m is used in medical imaging, and it's the most used radioisotope in medicine today. It can be used to take image scans of many different body parts, including hearts, bones, liver, blood, brain, lungs, and lymph nodes.